All right, we're gonna start by making sure that all of our equipment is clean, and we're gonna bring the baby and set it down underneath a radiant heater so that it stays warm. We're gonna put on our gloves, and we're gonna start by taking the vital signs. So the first one we're gonna take is the apical pulse. Got our stethoscope here. So we're gonna listen for 60 seconds, and the apical pulse of a baby should be between 120 and 180 beats per minute, depending on whether they're resting or agitated. We're also gonna listen for the S1 and S2, and any other heart sounds if there are. After that, once that's finished, then we're gonna check their respiratory rate. The average respiratory rate of a baby is about 30 to 60 breaths per minute. And we're gonna check to see when they're breathing if it's irregular, which it would be normal in a baby's case. And after that is done for 60 seconds, then we're gonna listen to the air entry on both sides. Okay. And then we're gonna watch their breathing and make sure that as their chest is rising, that it's symmetrical. We don't do SpO2 or blood pressure on infants. So the next thing we're gonna do is we're gonna listen for bowel sounds. So I'm just gonna roll this down a little bit. Listen to the different quadrants. We're just making sure that we can hear the bowel sounds so that we know there isn't an obstruction or anything. All right, when that's done, just gonna take this off, then we can check the baby for flexion. This baby doesn't really bend his arms too well, but we would check the arms for flexion and the legs for flexion. See that there's movement, symmetrical in both the arms and the legs. And then we're gonna move on to the head. So we're gonna start by checking the head for suture lines. We're gonna feel gently along them, make sure nothing is overlapping. Then we're gonna check for any caput. And there's nothing, then we're gonna look for the anterior fontanelle, which is at the top of the head. It's that big diamond shape at the front, and that closes at about 18 months. And then we're gonna move our hand along to the back, and we're gonna check the posterior fontanelle. That one is smaller, and that closes at about 2 to 3 months. So those are the little soft spots. So once that's done, then we can check for bruising. See if there's no bruising there. Check molding. This baby doesn't have any. We're also gonna check the ears, the side here. And at the back, we're gonna check for their shape. We're gonna look if there's any growths or skin tags. Looks okay. Then we're gonna check along the ears and follow a line to the eyes to see if they're aligned with the inner and outer canta of the eyeball. So this would be the inner and that's the outer. And we just want to make sure that if they're in line, then that's good. If they're too low, that can indicate a problem. So once that's done, then we can check the eyes for symmetry and discharge. This baby's eyes are symmetrical. And then we can move down to the nose. So the nose, we want to make sure that the septum is midline. We also want to make sure that it appears patent and that there are no deformities. We don't see any deformities. And then we can move down to the mouth. So the mouth appears symmetrical. There's no bruising, no cuts, no birthmarks. So that's good. So then we can take our finger and give it to the baby with the soft pad side up. So what we do is when we give our finger to the baby should start sucking as a reflex, and then we can check the roof of the mouth and that the palate is intact. Once that's good and checked, then we can look inside the mouth to see that the roof of the mouth is intact and that everything looks pink and moist inside. We also want to check the tongue to see if the baby is tongue-tied. If the tongue can come past the bottom teeth, then the baby should be fine. So next we're going to lift the baby's chin and we're going to check under the neck for any marks. We're also going to check that the head is moving equally to both sides. This baby's a little tough to do that. All right, now we're going to move down to the chest and we're going to check the trapezius muscles and we're going to check that they're equal on both sides. And then we're going to run our fingers along the clavicle. We're going to look for any lumps or bumps that'll indicate if the clavicle is broken or not. But that's usually if the baby's had a traumatic labor. Then we can run our fingers down the arms and we can check the baby's hands. So we want to check that the baby has all their digits, that there's no webbing in between the fingers, and we can look at the baby's palms and see if there are any palmar creases. This one looks good. All right, so we can come back to the chest here, and we're going to check the baby has 2 nipples, and we're going to check that there are no extra nipples. And we're going to move down to an abdominal assessment. So we're going to check that the abdomen is protuberant, and that would be normal on a baby. And then we're going to check that the cord is intact and that there are 3 vessels. You want to make sure that there are, and if you can't tell because the cord has been cut too close, then we need to document that in the notes. We also want to check that the clamp is intact. And we can move down to the legs. We want to look for any skin tags, birthmarks. We want to check for symmetry. We're going to check movement. And we're going to check the toes. We're going to make sure that there's 5 toes on each foot. We're going to look for webbing in between the toes. We can also do a Babinski sign here. And we can also do and check for plantar reflex by pushing in underneath the toes here to see if they curl. So once that's done, then we can check the groin. So we're going to check for any sign of vernix. We're going to make sure, you have to be careful if it's a boy that they don't pee on you. We're also going to check that everything appears symmetrical. If it's a boy, you want to check that the testes have descended into the scrotal sac. You can do that by pressing into the inguinal area and feeling to see if there's a little marble on each side. Then you want to check the penis and see if the urethra is coming out at the right point in the penis. And lastly, you want to check that the baby has an anus. So when that's done, we're just going to cover them up. And you can pick up the baby by their hands here and just lift them a little bit and let them go and see if they have a startle reflex. That's when their arms will splay open and then they'll come back in like a C formation with their fingers. So then we can flip the baby onto its stomach. Even though it's a newborn, like it should be able to turn its head. This baby's a little difficult. There we go. Okay. So we're gonna check the head, the neck, and behind the ears. Still looking for bruising, skin tags. If we don't see anything, then we're gonna run our finger down the vertebrae and we're gonna make sure that the back is straight. We also wanna make sure that there are no dimples or tufts of hair down the vertebrae, which can indicate spina bifida. Also, when we get down to the bum area, you should pull the cheeks apart and check and make sure that there's no tufts of hair or dimples all the way to the anus. So once that's done, we can check that the gluteal folds are equal in height and that the knee folds here are equal in height. You want to make sure that everything is symmetrical, so you can also straighten the baby's legs to make sure that everything looks symmetrical. And that's done. I'm just gonna put this back up and we're gonna flip the baby over onto its back again. There we go. Just gonna do up its diaper here. And then we can check for the tonic reflex. We do this by turning the baby's head to see if it goes into a fencing position. My doll can't do that. So you do that both sides. You can also check for the rooting reflex by brushing your finger across the cheek. The baby should turn its head towards your finger. You can also check a stepping reflex. So you do this by placing one of the baby's feet on the bed and seeing if they make a stepping motion. If you think that there's a neurological problem, you can go through all of the reflexes. The last thing you want to do is you want to measure the widest part of the baby's head, and you want to do this in centimeters, and you place it above the ears. So we're going to go this way. So that's 13 centimeters. In some places, you might want to do across the chest here, and you want to follow the nipple line when you go across the chest, so that would be 12 centimeters. And you want to measure the baby's length. So to do that, you want to put the baby up against the edge of the bassinet that it's in, and then you want to get them to straighten their leg. And then using a pen or a marker, you can make a mark when the baby's leg is straight about how long the baby is, and then you measure that to the edge of the bassinet. You also want to make sure you document if the diaper was wet or soiled and have the baby changed if necessary. If anything needs to be noted, make sure that you document it in the baby's notes. Abnormalities get passed along to the pediatrician who needs to check them before their discharge.